It was impossible, Mr. Speaker, sir, to outline all the roads that we're going to do in this. Let me move to aviation and rail. Mr. Speaker, sir, in the 2026-2027 fiscal year, government will rehabilitate the Bakiri Muluzi Airport, Kamuzu International Airport, and carry out preparatory works and designs for the new Nzuzu Airport. We are also going to expedite the signing of a memorandum of understanding for the Nakara Rail Corridor. We are also going to carry out advanced works for the Kanengo-Nchinji railway line and also commence feasibility and designs for rail expansion from the central to the northern region. And I'm also pleased to report to this August House that the Chinese government has expressed interest to finance this project. They want the railway line to start from Central Region up to Chirumba, because they want to open up the Northern Corridor. Marine and water transport. Mr. Speaker, sir.
Order.
Mr. Speaker, sir, in the 2026-2027 financial year, this government will complete construction of the Likoma port and rehabilitate and upgrade the Chipoka port as well. Allocation to social sectors. Allocation to social sectors. Mr. Speaker, sir, investing in human capital development is critical for socio-economic growth and transformation of our country. A healthy and skilled workforce is more productive and efficient, thereby positively contributing to the growth, development, and resilience of the economy. It is for this reason, Mr. Speaker, sir, that a total of allocation of 2.7 trillion has been provided towards the human capital development pillar of MIP1 or MIP1, education and skills development. Mr. Speaker, sir, a total of 1.28 trillion has been allocated to the education sector, representing 11.7% of the total budget. To increase equitable access to education and provide a fair chance to access knowledge to all the peoples regardless of their socio-economic background. Government introduced free primary education, as I've said, and secondary school, effective 1st January 2026, as alluded to above. Mr. Speaker, sir, the 2026-2027 budget has therefore refinanced resources amounting to 47.6 billion for this purpose. Of this amount, 31.7 billion is for free secondary school education, to cater for development fees, and 15.9 billion. Let me take this again. 15.9 billion is for free primary education to cater for general purpose fees as well as managed fees. Mr. Speaker, sir, a total of 11.3 billion has also been allocated to the budget to cater for free examination and students identity cards. Mr. Speaker, sir, an allocation of 11 billion has been provided for teaching and learning materials in both primary and secondary schools. This represents 122% increase from the 2025-2026 revised provision of 4.96 billion. In addition, a total of 45.7 billion has been allocated to the operations of secondary schools and teacher training colleges in the amounts of 31.4 billion and 14.3 billion, respectively. Mr. Speaker, sir, I also wish to report to this August House that government has allocated resources amounting to 234.3 billion to the country's 6 public universities. These resources are broken down as follows: 171.97 billion for operations, 45.2 billion for development projects, and 17.1 billion for repayment of service gratuity loans. It is government's intention that public universities should not predominantly rely on government subvention. To this effect, Mr. Speaker, sir, after thorough consultation with various stakeholders, students with capacity to pay and those coming from private secondary school who are capable to pay will be required to pay cost-reflective fees, so that students' loan subsidies should only be provided to those who can afford, who cannot afford. I think I need to take this because it's very important. To this effect, after thorough consultation with stakeholders, students with capacity to pay will be required to pay cost-reflective fees, so that students' loan subsidies should only be provided to those who cannot afford. To achieve this, all university management are directed to categorize those students who can afford from those who can afford from those who cannot. Mr. Speaker, sir, the 2026-2027 budget has also set aside amounting to 42 billion. Mr. Speaker, sir, I need protection from the front row here.
Honorable Whip, please control your front line.
Mr. Speaker, sir.
Let's have order.
Mr. Speaker, sir, the 2026-2027 budget has also set aside resources amounting to 42 billion for students' loans and upkeep allowances to cater for 40,000 students in public universities, as announced in the SONA by His Excellency the President, Professor Arthur Peter Mutharika. Mr. Speaker, sir, to provide the requisite job skills and make our graduates employable and ready and competent for absorption into the job market, there is a provision of 4.5 billion for graduate internship program. Additionally, resources amounting to 3 billion have also been allocated to prioritize completion of community technical colleges. Health sector. Mr. Speaker, sir, a total of 1.02 trillion has been allocated to the health sector, representing 9.2% of the total budget. Of this amount, 108.3 billion has been set aside for procurement of medicines and medical supplies, representing a 13.1% increase from the 2025-2026 revised provision of 95.8 billion. This allocation is in the amounts of 58.3 billion and 50 billion for central hospitals and district hospitals, respectively. And this allocation, Mr. Speaker, sir, is an addition to the support that we're also receiving from donor partners. What I'm reporting here is what government will spend, but there are more resources that are coming from donor partners. Mr. Speaker, sir, as you are aware, central and district hospitals, or Central Medical Stores Trust, CMST, outstanding payments for the medicines and the medical supplies drawn down from the trust in the previous financial years. Government has therefore allocated 20 billion as part payment of these arrears. This will ensure consistent supply of medicines in our hospitals. Mr. Speaker, sir, a total of 65.7 billion has been allocated for operations of the central hospitals and the procurement and the maintenance of medical equipment in these hospitals. This represents an increase of 34.4% from the 2025-2026 revised provision of 48.9 billion. Mr. Speaker, sir, resources amounting to 25.3 billion have been earmarked for the operations of these hospitals. This represents a 10% increase from the previous 2025-2026 revised amount of 23 billion. Mr. Speaker, sir, I'm also pleased to report that the Malawi government has secured financing amounting to 744 million from the government of the United States of America. These resources are aimed at strengthening health systems and combating TB, malaria, HIV, and AIDS, and other infectious diseases. Mr. Speaker, sir, in order to address the challenges in renal ailments and treatment, 3 billion has been allocated for the establishment of dialysis centers. And this will be done in a phased approach, starting from Mzuzu Central Hospitals. And other notable allocations in the sector include 11 billion for blood transfusion services, of which 5 billion is for central hospitals and 6 billion is for district hospitals. 3 billion for referral medical cases abroad, 1 billion for procurement of ambulances, and 1 billion for ART co-financing with the Global Fund. Mr. Speaker, sir, it is also evidently clear that there are a lot of areas that require financial support to achieve universal health coverage through improving access and quality of health care service to all Malawians. Mr. Speaker, sir, it is therefore important for government to come up with innovative means of mobilizing and pooling resources to this sector to strengthen its service delivery. In this regard, Mr. Speaker, sir, government has introduced paying wards in all the central and district hospitals so that people that can afford to pay for health care services should do so, thereby subsidizing those that are unable to pay. Mr. Speaker, sir, regarding healthcare infrastructure, government will commence construction of Blantyre and Chikwawa district hospitals in the year 2026-2027 financial year, with financing from both government and development partners. Social protection. Mr. Speaker, sir, government will continue to mitigate against the negative impact of economic downturn and price escalations on the poor and the vulnerable groups. In this regard, various interventions have been put in place to safeguard the underprivileged sections of the society, and some of these interventions are as follows. 1, distribution of relief means to households that have been severely affected by drought and hunger, consistent with the recent Malawi Vulnerability Assessment Committee report.